it's Scott. And for the last couple of days, we've had the pleasure of playing here in Las Vegas with Sunrise Children's Neonatal and Pediatric ICU transport team. And one of the things that we wanted to go ahead and touch on during this Give Me 5 is the use of traditional blades versus one of the new fancier toys. Now, not only for adults, but for kids and babies as well. And that's the latest version of the GlideScope. And with that, I'm joined by Stephanie, who is one of their flight nurses, and Jared, who is one of their flight respiratory therapists. And we're going to go ahead and just quickly touch on the new toy, meaning your tiniest versions of GlideScopes.
All the blades are disposable, one-time use. This is their proprietary blade. It's called the Low Pro. This goes down to a size 1 and then all the way up. This one is their traditional straight blade or Miller blade, and the lowest this one goes is from 0, which is nice for us because some of the other visual scopes that we've looked into don't go quite this low. So one of the benefits of the GlideScope Go is that it does have these lower blade options, since we are a neonatal transport team, in addition to peds. So how it works is you just connect the monitor, you clip it in. This does have recording capabilities. It comes with a little dongle that we would attach if we want to record. So normally on transports, we will throw that in prior to intubation, just so we have video, confirmation, and we have proof that it did in fact successfully pass the cords. So, just like any traditional intubation, obviously, you want to make sure the airway is nice and suctioned, and make sure you can visualize the cords. You can see Steph has a nice visual there. She's lifted, the epiglottis is up out of the way, and she has a nice view of the cords, and she's able to pass the tube pretty easily.
Can you take the stylet?
Yeah. Let's take this.
All right.
Perfect. Now, why this is important is you saw during her technique, she did a couple things, right? First of which is she looked for the cords. But more importantly, when she was staring at the cords, she never took her eyes off of the cords, right? Meaning either A, somebody hands you the tube, or B, while you're staring at the cords, you take your finger and you reach over for where the tube is going to be. And when I first started playing transport, that's what anesthesia taught us. They're like, look at the cords, always look at the cords, never stop looking at the cords. And if Elvis himself comes back from the dead and walks in through the door, you only give appropriate homage to the king after you have stopped looking at the cords and watched the tube go through the cords. Now, what's really kind of neat about this, though, is as they touched on, is a couple fold. The first of which is it goes all the way down to baby sizes. And that's important because some of the other toys out there do really well for adults and kids, but not so much when it comes to babies. Number 2, as he said, there's traditional blades, meaning it looks like a straight, or they've got the fancy curved one. It hopefully doesn't fog up, is what they described. It works pretty well with that. So that's important because, again, some of the other devices out there tend to work really well but they also tend to get fogged up. And just simply from a testimonial is twofold. The biggest of which is from a medical legal perspective. This is absolutely huge to have a device that you can have video confirmation of, like Jared touched on, literally seeing the cords, watching it go through the cords, and having it on video that it went through the cords. Because that way, if something icky happens and it goes to court, literally, you can sit there and watch the fact that it went through the cords. And if you pair that with ongoing capnography, where you can see the nice pretty wave, to make sure that it's in and that it stays in, it just makes that whole question as to whether the tube was in or not a whole lot easier. So the last thing we wanted to touch on when it comes to this new fancy toy is really kind of neat. And that's through Pedi-Ed. For the past 15 years or so, we've been putting on these pediatric pig labs. And specifically for over 15 years, we've gone ahead and tried to intubate our little fetal pigs. Because people across the board have asked for pediatric intubation practice, and mannequins are nice, but if you want to learn, you really have to touch tissue. So for 15 years we've tried, and honestly the only way we've been able to get into the airway is by taking a scalpel, cutting open the neck, and physically cutting the trachea. However, first time, 15 years. First attempt. With the scope, Stephanie was able to go ahead and successfully intubate the trachea. And again, as a disclaimer, we don't work for this company. We just like to promote and show new toys. But first time, 15 years, you know what? This is probably a toy you should give a try.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best: under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next peds patient could be your worst peds patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.